People sometimes think it's relatively easy to get pregnant, but in reality, it can take many attempts. Additionally, it's not uncommon to experience fertility problems that make it more challenging to conceive. How many couples find it difficult to get pregnant? What are some of the causes? How do healthcare providers treat infertility? In this video, we'll cover these questions and more. So let's dive in. Now, what are the infertility rates in the United States? In the United States, 1 in 5 women between the ages of 15 and 49 years deals with primary infertility. Primary infertility means that the individual has never achieved pregnancy, says the World Health Organization. Approximately 1 in 20 women struggles with secondary infertility, which means they've been pregnant at least once before. Overall, about 48 million couples around the world experience infertility. For infertile couples, it's typically assumed that the female reproductive system is to blame. However, in 1/3 of couples, male infertility is the cause. In 1/3, female infertility is the cause, and in the final third, male and female infertility is the cause or the problem cannot be identified. So, what is female infertility? In general, infertility means that a couple of childbearing age has been having frequent unprotected sex for at least a year with no luck conceiving. Now, what factors affect fertility in women? Many variables can affect fertility, including problems with menstrual periods, such as absent menstrual periods, sexually transmitted infections or STIs, pelvic inflammatory disease or PID, blocked fallopian tubes, and other problems with the female reproductive system. Uterine fibroids, lifestyle factors such as substance abuse, drugs, alcohol, and tobacco, and getting too much exercise. Problems with ovulation are some of the more common causes. These can be caused by polycystic ovary syndrome or PCOS, thyroid disease, and premature ovarian failure. Okay, so can men be infertile? Yes. In fact, if a couple is finding it difficult to get pregnant, male infertility is just as likely the cause as female infertility. Lifestyle factors can cause infertility for the male partner, in addition to health problems like genetic disorders, an undescended testicle, and testicular failure. Anything that impacts sperm count or sperm quality can also contribute. For example, exposure to contaminants like pesticides, drug use, and spending time in hot tubs and saunas might all impact sperm count or sperm quality. Low sperm count and poor quality of sperm are the most common causes of infertility among men. Now, here are a few myths about infertility. Some believe that premature ejaculation can cause infertility as well as erectile dysfunction or ED. However, this isn't necessarily the case. Neither of these automatically means that sperm are less abundant or of lower quality. But some conditions that cause ED may also impact the sperm, so further testing might be needed. Finally, we want to debunk the myth that infertility and fertility care hurt child health. There is no solid evidence that if you experience infertility or receive fertility care, your child is more likely to experience issues like birth defects or developmental delays. This is a common misconception. So, are infertility rates increasing? While the jury is still out, recent research from the Centers for Disease Control and Prevention, or CDC, has pointed to an increase in infertility rates. In particular, they said that the general fertility rate in the US dropped by 3% in 2022, marking a historic low. There's a pattern emerging. While there was a 1% increase from 2020 to 2021, from 2014 to 2020, fertility rates dropped by 2% each year. Why? There could be several contributing factors. Infertility coverage by insurance companies is seriously lacking, making cost a prohibiting factor. Additionally, fertility care is often unavailable in certain geographical areas, leading to fertility deserts. There are also considerable disparities based on race and socioeconomic status. For instance, Black and Hispanic women use these medical services less frequently than white women, sometimes due to lower incomes on average. LGBTQ plus people also frequently face more hurdles when it comes to finding accessible and affordable infertility services. Until fertility care is readily available to all individuals, regardless of factors like race, sexuality, and income, infertility will continue to be a global problem. Now, what do fertility treatments look like? There are several types of infertility treatments, including assisted reproductive technology, which is any fertility treatment where eggs or embryos are handled. Medicine. Certain medications can stimulate ovulation to improve female fertility. There are also drugs to improve male fertility. Surgery. This depends on the cause of infertility. Fallopian tube surgery, if they're blocked or scarred, and laparoscopic surgery to address endometriosis, fibroids, and PCOS are some of the options. Assisted conception. This includes reproductive technologies like in vitro fertilization or IVF, as well as intrauterine insemination or IUI, the latter of which is a type of fertility treatment called artificial insemination. The type of fertility care needed depends on what each couple is experiencing. If you're encountering unexplained infertility, talk to your provider about undergoing fertility tests. So, what lifestyle changes can help reduce the risk of infertility? Remember, infertility affects men and women equally. Both partners can support their reproductive health and ideally make it easier to get pregnant by following these tips. Don't drink alcohol. Alcohol can hinder your reproductive hormones and hurt the functioning of the testes, which makes it harder for the sperm to reach the egg. Maintain a healthy weight. Being both overweight and underweight can cause problems with hormones and menstruation. Monitor your overall health. In particular, high blood pressure can lead to impaired semen quality. You can encourage healthy blood pressure through diet and exercise, avoid drinking and smoking, get enough sleep, and find positive ways to cope with stress. Protect your sexual health. STD testing is a quick and easy way to ensure that both partners are healthy and free of any dangerous diseases and infections. By avoiding these risk factors and caring for your general health, you can reduce the chances that you will experience infertility. If you've been having unprotected sex for a year and still haven't been able to get pregnant, a fertility tracking panel can help. eNational Testing's panel quantifies two of the most common fertility measures, progesterone and anti-Müllerian hormone, or AMH. Progesterone helps us better understand your current fertility, and AMH gives us an idea of your overall ovarian health. Learn more about your number of remaining eggs, ovulation, and the cause of your infertility. eNational Testing has more than 2,700 locations around the United States. Find a testing center near you.